assurance. So as in GMP, it ensures the quality that is built into the organizations and processes involved in the manufacturer. So GMP covers all the aspects of manufacture, including collection, transportations, processing, storage, QC, and delivery of the finished products. So as in good manufacturing practices, as it says, it's mainly the initial part that you're thinking about, bringing it all together. But as a processing and storage, all the things that going to happen, that have been dealt within this part. So actually, if we see the quality assurance, within the quality assurance, your GMP and QC, quality control, comes. So QA is a big thing. So part of QA, which ensures that products are consistently produced and controlled to the quality standards appropriate to the use, and GMP is an integral part of that QA. So we can say QA, GMP, and QC. They are all interrelated with each other, and if something is not working between them, so it's not working out. So it is a sum total of organized arrangement with the objective of assuring that products will be the quality required for the intended use. So the end product that is producing in the market, that is coming up, that we see in the chemist shop, whether it's a facial or any oil for the hairs or any deodorant or any medicine, even the mask, whatever the things that you're seeing, there are a lot of products in the, just try to even like start to increase your awareness in each things whenever you're going any shop, or even when you're studying, or when you are standing still somewhere while taking the bus. Just try to observe your surroundings, how every minute things, they have quite important things to say. So further, as it says, the QA is the sum total of all things. GMP, which is a part of QA, actually aim to ensure that products are consistently manufactured to a quality appropriate to the intended use, whereas the QC is a part of GMP actually, which is concerned with sampling, specification and testing, and documentation and release procedures, which ensure that necessary and relevant tests are performed and the product is released for use only after a certainty its quality. After some time, we are sure that the things that are being produced later on, they are being produced nicely. In order to do so, QC is done. So QC and QA, so part of GMP, which is concerned with sampling, specification, testing. So these terms are coming up on regular basis: sampling, specification and testings within the organization, documentation, release procedures to ensure that necessary and relevant tests are carried out in that case. Whereas a QA, which is a sum total of organized arrangements made with the objective of ensuring the products will be quality required by their intended use. And beyond that, I want to also, there's a book by Manohar. Okay. Manohar Poddar. So this is a book by Pharmaceutical Quality Assurance. It's a PDF ebook. So all the things that we are talking about here in this presentation, so all these topics, so we have discussed these premises. Now we have discussed the introductory part. The more we will discuss coming up: quality management, documentations and records, and many things. So in this book, everything is been given in very nice manner. Your records, you can have an access to this book now. So I will share this book. I recently found that book actually. And it's a, I don't know if you know, but it's a Bible for quality assurance actually, believe me. It's okay. Then operational, in QC and QA, operational laboratory techniques and activities used to fulfill the requirement of the quality, and all those planned or systematic actions necessary to provide adequate confidence that product will satisfy the requirements for quality. Then QC is a laboratory based and QA is a company based. Further, GMP, if we talk about GMP, it's done in the solid dosage form. It could also be done in semi-solid dosage form and liquid orals. Parental productions, Ayurvedic medicines is done for the GMP. GMP is also done in the biotechnology products, nutraceutical and cosmeticals, or in the homeopathic medicines. So these things that even still these Ayurvedic nutraceuticals, phytoplant hormones and homeopathic medicines, all the alternative medicines, they didn't got as space as the allopathic at the moment, because with the allopathy we can see the effects, the relief from the pain or any things that you're looking for, we get quickly the results out of it. But with the allopathy and all alternative medicines, they take some time to give you relief. But that's the best part, that they do not have as side effects as the allopathy. So some of my relatives, they were having a pain in their shoulder and the knee, so they were taking ibuprofen on regular basis, and nobody told them that you should not take them on regular basis. So because of getting relief from the pain from the knee, that medicine had a side effects on the liver. Yeah, and the liver with the time was not as good as it should be. So this is how things are working out. So once you are taking one medicine for one thing, so it might be doing side effect to another organs, which you might see after 1 or 2 months. So be careful, whichever the medicine that you are taking, um, any like taking on. So please be aware of that. I mean, best at the moment is, they say, to live more. Actually, eat less. The more you eat less, and you can live longer. And keep yourself busy for the whole day. Whether any work that you like the most, that is you're passionate about it, keep doing that for the whole day. That by and do your exercise regularly. So by the 10 p.m., 9 p.m., you are so um, like broken out of that work, that you have no pain to think about anything, and you just automatically go for sleep. So in that case, this alternative medicine, the alternative way of living, it really helps us to go for further, a better life, I would say. Then good manufacturing practices, good management practices, GMP, get more profit, get more production, GMP training without tears. So these are some other names that people have given it. So main 10 principles of GMP, if we see. So first is, you design and construct the facilities and equipment properly. So all the machinery, all the lab equipments, all the production equipments, they have to be carefully taken care that everything is there. Then follow the written procedure instructions, document them, validate them, monitor facilities and equipment, write step-by-step operating procedures like SOPs, and work on instructions. So this is also an art, actually, a step operating procedures, SOPs. Um, in order to do so, because everyone, all of us, I was thinking today that everyone, each of us, I'm a teacher of you, so there might be some teachers who are much better than me, and there might be teachers who is maybe, I think myself, I'm still want to be better teacher to go up, right? And so there's a thing in the competition, there's always people who are better than you. So if I'm writing a step SOP in my own way, there will be one other person who might be writing in much way better than mine also. It's just I have to believe in that the level of what I'm working is up to the mark, but it could be also be improved. Yeah, so this thing comes from the inner voice, that do I have to be better than that, is that what that person work is better than mine or not. So you have to see and calculate yourself regarding the same. So it's always there's always scope for betterment, there's always scope for improvement, and never ever get satisfied with your achievements. You got the first prize you got the golden uh, gold medal for your let's say biochemistry honors. Then you should also aim for masters in your MSc, go for gold medal, and keep going up and up, and never get like, okay, I have achieved this thing now, and I don't want to go up. It's I'm happy, I'm satisfied now, and from that day, the downfall starts actually. The day you think that I've achieved the highest point of my life, I'm done. So you can't go up. I mean, I'm sharing these things from the recently talks by Anupam Kher. He's now talking a lot of motivational stuff on over the Instagram and Facebook. So there was a conversation with there's a beer bicep guy who's on the YouTuber who's making a lot of podcast, and in that he said to the I don't know Alabhadia, his Ranbir Alabhadia, I guess, that the day you will see that you have achieved the thing that you have made to the top, on that day the downfall will start. So never ever get satisfied. Keep achieving, keep going up. If you got 95 marks out of 100, achieve for 97, 98. Yeah, if you got one PI that is doing this work, try to do the best for him, do the best work for them person, that you put a good stamp out of you there. You're like you know what you have done, and people remember your name the day you left that place, after you have given your best to the lab or any institute, any class, if you are in, wherever you are working. Just try to give best out of yourself. Then protect against contamination within that place. This is also one of the good manufacturing practices. Design, develop, and demonstrate job competition. Control components and product related processes, and conduct planned and periodic audits. Right? So everything in these 10 points have to be maintained one by one. Each things are quite important for the GMP in order to get the best results of your institute. So what is beyond GMP? So you can reduce the pollution, zero discharge, adaptation of environment friendly methods, consideration for better and healthier life tomorrow, consideration of ethics in life, and one should begin with end in mind, otherwise it will be the beginning of the end. Because they say that ethics, there's always I don't know if you're in your university have it, there is human ethics values, there's a class of that also, in which we just teach the basics, that how should be the ethics in our life, how should we work in a way which is to be honest in academia is hardly achieved nowadays. It's a lot of fight, there's a lot of competition, I'm telling you honestly. Is the one who's the best, is the one who is doing the best thing will go to the top. So be careful, be aware of that, of your surroundings when you come to the academia or in the industry also. um, just be the best version of yourself always. Consider for better and healthier life for tomorrow, this has to be achieved also. Environmental friendly methods has to be there. And think always the end, that if you're gonna join one unit, one company, and you're gonna work there for let's say 2 years or 3 years. So keep your in your mind that by at the end of 3 years, what are the basic things that you want to achieve? What are the green tick marks you want to make by the end of your working there? Yeah, so which will make you satisfied. Actually, there's a lot of self-esteem is there. Everyone has it. So begin everything with the end. Otherwise, it will be the beginning of the end. Because if you're not aware of what you're gonna want at the end of your work, then yeah, then cost of effective GMP. So in fact, cost benefits, positive cost benefits of GMP and QA. So good plant layout, smooth workflows, efficient documentation system, well controlled processes, good stores layout, stores records. So these all belongs to your GMPs, good manufacturing practices. Reduction in work in processes and inventory holding cost, avoidance of cost of quality failure, cost of waste, rework call, consumer compensation, loss of company reputation. So all these things matters a lot. So these are the various, these 10 to 11 points, the important documents has to be taken care in the good manufacturing practices. That is the policies, statement of purpose, sorry, statement of your program, specifications, master formula record, BMR manuals, master plans, validation protocols, forms, formats, and records. There are a lot of documentation has to be taken care. So for that you have to be. We will go in details about them in our upcoming lectures, and we will see that what are the important documents that are required for them. So these are the main documents that are required at the moment. So how do these GMPs, they're different from countries to country. So at high level, GMP of various nations are very similar. Most require things like equipment, your facilities that are being designed properly, maintained nicely, and clean always. SOPs of your written and approved, whatever the SOPs that you're making out, they have to be approved and written. An independent quality unit like your QC and QA should be independent both, and your personnel and management, your people that you're working there, they all should be trained and has to be, yeah, good way. I mean, these things that we are discussing here, these are the for the people who wanna work as a, as a GMP expert or a QA expert, QC expert, because in each places, in all the big pharmaceutical companies, whether it's a Nestle, even the food, Maggie, Nestle, Johnson and Johnson, GlaxoSmithKline, Biocon, right? In Baddi, there's so many. In Gujarat, there are so many. So every unit have these QC and QA and GMP. It's just initially it's very hard to understand that what are the, because each lab, each industry, each procurement that you want to work, they will have their own set of rules. You will be you are aware now at least that what are the things that you have to work when you will be working as a Q and QC expert. But you have to, when you start, you have to adjust to the new facilities, new things there, and slowly things will start to develop and making things done. So basic requirement of GMP. So all manufacturing processes are clearly defined, systematically reviewed, and shown to be capable of consistently manufacturing medicinal products of the required quality and complying with specifications. And critical steps of the processes and significant changes to the process are validated. So why this GMP is so important? It's poor quality medicine may contain toxic substances that have been unintentionally added. So medicine that contain little or none of the claimed ingredients will not have the intended therapeutic effects, right? Now comes your quality, a little bit about quality management here. So as we know, quality management includes your quality insurance, and quality insurance includes your GMP, and GMP further includes your QC. So that's how your quality relationship matters here. So the quality management actually is the aspect of an management that function and determines the implementing the quality policy. That the quality policy that you're bringing in, that how it will be, and we have to implement them. Sorry. Then overall intentions and directions regarding the quality as formally expressed and authorized by the top management. So some basic principles. First is manufacturer should ensure that cosmetic products comply with requirement of the ACA and cosmetic directives. So this is ACDs. These are directives that has been provided if somebody is going to work with the cosmetics, and they should be comply with any other applicable regulations per training to your specific country. And attainment of these quality objectives should be led by the senior management and requires the participation and commitment by the staff and by the company suppliers and distributors. Then second, to achieve reliable quality objectives, there should be comprehensive QA system and incorporate GMP into them. And beyond that, the QA system should be fully documented and effectiveness should be monitored also. And under the quality management QMP comes your QA. As we have discussed that in our previous two lectures, that it covers that all the influence of the quality of a product. So QA is actually a system which includes a component, personal, suitable, sufficient premises, equipments, and facilities at the end. Yeah. So as we know, in the QA, it's cover all the, we will have a little bit repetition, all the matters that individually collectively influence. The drug is the right quality for the intended use, and it's incorporate GMP and also product design development, which is outside the scope of this module. Then basic requirement of QA that ensures the products are designed and developed based on the sound scientific rationale with GMP or GLP principles being taken into the consideration. Ensure that managerial responsibilities are clearly specified and the production and control operations are clearly specified, the GMP is adopted. Unorganized supply used for correct starting and packaging materials, and they ensure finished products are correctly processed and checked before release, and the products are released after the review by the authorized person. So provide satisfactory arrangement to ensure products are stored, distributed and handled appropriately. So put in a place mechanism for regular self inspection, internal quality audits are taken care of. So QA, which ensures the products that you're producing, they're consistently produced and controlled to the quality of standard appropriate to the intended use. So you have minimized risk like cross contamination, mix up. Ensure products materials are traceable to the original source. Testing is not reliable way to assure product quality. Should build quality into the product, and production and quality control functions should be independent of each other. And all manufacturing processes are clearly defined and systematically reviewed. So all necessary facilities resources for GMP should be provided. Adequate, qualified and well-trained personnel, suitable premises, sufficient space, suitable location, good personal hygiene, proper sanitation, and suitable equipment and services. And the QC, which is further is a part of GMP, it's concerned with sampling, specification and testing. Manufacturer has QC department headed by appropriately qualified, experienced person, independent from the production other departments, ensure that necessary and relevant tests are actually carried out, ensure that no materials or products will be released or sale or supply until their quality have been evaluated. So what are the scopes? So item concerned like starting materials, packaging materials, bulk products, intermediate finished products, environmental conditions. So all these are thing has to be taken care. And in the QC, what are the basic things that you have to maintain while doing so? Adequate facilities, trained personnel, approved procedures has to be there. Sampling of your quality control, personnel testing of methods, approved test methods, maintenance of QC records and failure investigation records. So I'm stating these things very easy manner in 1 or 2 minutes, but believe me, when you have to work them personally and to be we have a regular on work on the regular basis, by the end of it there will be a lot of data you have to maintain, and there should be no chance of error at working there also. Even though if you find some error, there are some failures in your record documentations, it will be disaster for the whole company. So these people of QC and QA, they are the most accurate person, they are the most highly advanced, I would say, skills people, the things while they are taking care. And they are being also paid very nicely because you are doing a very hard job there, and for the same you will be also paid nicely, believe me. But the thing is, also in India the amount is okay. If you get really good MNC company, multinationals, they will really take care of their employees. But if you're into some private company, we have started a job, then it will be hard to have a good salary, and the conditions might be not so as good as in the MNCs. This is in everywhere, whether you are working for Infosys or Google, or then you're working for some private and software developers in some companies. So there's always a difference working for MNC and from the private companies, that we have to see, right? So, and second is ingredients comply and the regulatory specifications, review and evaluations of product documentations, assessment of process deviations, release of batches by authorized person, and sufficient reference sampling of the starting materials and finished products. So other duties of QC: establish QC procedures, manage reference standards, ensure correct labeling, stability testing, complaint investigations, environmental monitoring. These are some of the duties, the quality activities that the quality testing has to do, QC has to do: sampling, specification, testing, release procedures, recalls and complaints, decision making in all quality matters, definition of product quality, laboratory operations, release authorization, investigation and reporting, and so on and so on. Yeah. So some of the basic requirements of quality control: so adequate facilities, trained personnel, and approved procedures has to be done for the sampling, inspecting and testing, and sampling of QC personnel and testing by approved methods, approved test methods, maintenance of QC records and failure investigation records, ingredients comply with regulatory specifications, review and evaluation of production documentations, assessment of process deviations, and so on. And other duties of QCs are to establish your QC procedures, manage reference standards, ensure correct labeling, stability testing, complete investigation, environmental monitoring. So all these things has to be also taken care. Yeah. Then comes personal level, that how QC and everything has to be taken care. So adequate staff with relevant knowledge, experience and capabilities in assigned tasks. For example, production and QC are headed by different person, neither of whom shall be responsible to each other. And further, responsibilities and authority of key personnel are clearly defined. And training on the understanding of procedures, work instructions, GMP principles, and so on. Each person engaged in the manufacture, processing, packing, or holding of a drug product shall have education, training, and experience, or any combination thereof to enable that person to perform the assigned functions. So training has to be taken care. And they are competent and appropriately qualified personnel in sufficient numbers to ensure service provision. And the responsibilities of all staff should be clearly understood and recorded. All personnel receive initial and continuing training relevant to that thing. And competency assessments can also be used to assess procedural training. So three key personnel: the head of production, head of QC, and head of quality management. That is your QA. So these three are the three key personnel people that are governing one industry, one place: your production, QC, and QM. So the head of production should be a qualified pharmacist, right? Adequately trained, possess good practical experience in pharmaceutical manufacture and managerial skills. So this, I mean, if you're into the B pharma, into this field, so believe me, once you have all the bookish, like it's all academic knowledge, then comes your practical knowledge. So you will be added into the lab. You have to work in the industry. Sorry, lab is coming up because I'm into the lab more. I was more into the lab so far. You will see that things will not come in a day. You will develop for 1 month, 2 months, 3 months. By the end of 6 months, you will see that you have reached from that level to that level. You have gained a lot. So this is with every field, whether you are driving a cycle, whether you're driving a car, whether you are driving an aeroplane. On the first day, you will be a very untrained person, but with the time you will be trained. So keep that confidence within you that you will be master of that field one day, but it will take some time. It's just while doing so, you should have patience, you should have perseverance, and you should have passion. These three things are the mixture to reach you to the top of your goals, right? So I'm saying sometimes these things also in between, not to just keep things academically performed here, but beyond that you should be motivated, that what is the vision of your goal is. So I'm not saying that you should do this particularly. If you have been with me since the start of the lectures, the start of these classes, I want you, all of you, that you have to identify your own skills, that what you want to do, what you want to go for. Once you have found that where this is where you want to go for, and then keep achieving the ladders of that, keep having professional people, keep making networking within that field, that will help you to grow in that field. Yeah. And head of production should have full authority and responsibility to manage production and pharmaceutical products. And the head of QC has to be also a qualified pharmacist, adequate training, practical experience, which enable them to be function personally. And the head of QC should have given full authority and responsibility in all QC duties. And the head of QM, this is quality management or quality assurance. He should also be a qualified pharmacist, have adequate training and practical experience, which made them to perform functional personally. and they should given full authority and responsibility on quality system and assurance duties. Premises, this we have discussed actually yesterday in full way actually. So we have discussed about wall, ceiling, air intake, certain activities has to be taken care, toilets, changing room, sampling, prevention of mix of materials, so storage areas, yeah, define certain activities, so these so building and facilities, maintenance, sanitation, washing, sewage, plumbing, lighting, design, right? Paint finish, not only building paint work must be considered, but also the equipment that you want to use, right? So if this is the equipment that you are working for, you can see the paint are getting removed. So equipment needs to be properly, because they are producing tablets and many things, but if they are in this rusted form, this is not good for your production then. So this also has to be maintained also. So yeah, some of the things that are acceptable: epoxy enamel paint, flush glaze windows, smooth surfaces, concealed surfaces, hygiene drains, homogeneous seal floors, smooth steel sink ceilings, flush light fittings, steel or melamine furniture, and so on. Floors like tiles, draining has to be there also. Any building in the manufacturing, processing, or packing or holding of drugs shall be of big size, suitable size. So the proper lighting is there, proper channel of moving from one place to another. The stairs are there. Electricity has been done very nicely. Everything is clean and nicely maintained. The production area has to be taken care very carefully, that it is out of any dust, aseptic, and good supervision. Weighing area, that how much things that you're producing. Storage area, it should be quarantine stocks. Design, security, cleanliness has to be taken care. Um, Separate place for hazardous substances, storage area, right? Ventilation, air filtration, air heating and cooling. We have discussed that yesterday in a big details. Yeah. So this is a poor window, like you can see in a very old manner, and this is a clean one, a proper nice one window, one glass. So these small things matters a lot, really. These things matters a lot. Your QC areas, your ancillary areas, so has to be maintained very nicely. Yeah. So that's it for today class. Right. So this was this, and third part I want to discuss by you. GMP, relationship between GMP and QC or QA. So that's it for today class. We see us then tomorrow. We will go in more details about further topics. So at the moment, yeah, that's it for today. Okay then, take care. Bye bye. Thank you again for the wishes.